One of the most common questions that I hear is what is the difference between dementia and Alzheimer's disease? Many people use these terms interchangeably whenever they are not the same thing, and understanding the difference can help families know what to expect and better make decisions about care. So let's start with dementia. What is dementia? Let's think of it as an umbrella term, so an overarching term. Dementia itself is actually not a specific disease. Instead, it is a collection of symptoms that affect the memory, that affect language and judgment and reasoning, or even the ability to perform your everyday activities. And for someone to be diagnosed with dementia, these symptoms have to be so severe that it interferes with their daily life. Some common symptoms that we see include memory loss, difficulty problem solving, confusion about time or place. Maybe there are changes in judgment or even personality or behavior changes. And there are many different diseases that can cause dementia. The first one being Alzheimer's disease. Yes, Alzheimer's disease is the most common cause of dementia, accounting for 60 to 80% of dementia cases. And Alzheimer's is a disease of the brain. Over time, abnormal proteins build up in the brain, causing nerve cells to be damaged and eventually die. And as more brain cells are affected, symptoms gradually worsen. The earliest symptom is usually short-term memory loss, but as the disease progresses, other symptoms may be experienced, like difficulty recognizing their loved ones, or problems communicating, or even changes in their personality, or trouble walking, or difficulty swallowing, or increased need for assistance with their daily activities. Alzheimer's is progressive, meaning that the symptoms over time are going to get worse. Not everyone who has dementia has Alzheimer's disease. There are actually several other common types. So we've got Alzheimer's disease. We also have vascular dementia. This often occurs after a stroke or if there's reduced blood flow to the brain. People who have this experience slower thinking, difficulty planning, maybe even problems with their attention or even memory problems. The third type would be Lewy body dementia, where Lewy body proteins are built up in the brain, and you often see visual hallucinations, Parkinson's-like movement problems, fluctuation in their alertness, and many sleep disturbances. The fourth type that we commonly see is frontal temporal dementia, affecting the frontal and the temporal parts of our brain. We usually see this affect younger adults compared to those who are diagnosed with Alzheimer's, and early symptoms can be personality changes, poor judgment, inappropriate social behaviors, and language difficulties. But each type affects different parts of the brain, so symptoms can look very different. This is another question that I get often. Can dementia be reversed? Some causes of dementia-like symptoms can be treated, including vitamin deficiencies, thyroid problems, depression, UTIs, dehydration, or even sleep disturbances. However, diseases like Alzheimer's, Lewy bodies, or frontal temporal dementia are currently not reversible. That is why it is so incredibly important to get a thorough medical evaluation if someone develops a new memory problem. How can you as a family member help? Although we cannot reverse or cure dementias at this time, we can absolutely improve their quality of life. So families can help by keeping their routines very consistent, providing meaningful activities, encouraging them to have safe physical activity, focusing on their abilities, not on their limitations, and offering really good reassurance that they are okay instead of arguing with them. These small changes often make a really big difference in the lives of your loved ones. So I'm going to leave you with this thought. Dementia is the umbrella term. Alzheimer's disease is one type of dementia, and understanding the diagnosis helps us better understand behaviors, communicate with our loved ones more effectively, and provide the compassionate care that we all wish to provide to those that we love. And remember, dementia changes the brain. It does not change the value of the person that's living with it. Every individual deserves dignity, patience, and respect throughout their journey. And if you're caring for someone with dementia, make sure to like and subscribe because you don't have to do this alone.